Welcome to the Pharmacy Podcast Show. You are listening to the first and only podcast dedicated to the business of pharmacy. You can find all of our episodes at pharmacypodcast.com.
Welcome to the Pharmacy Podcast. I'm your co-host in 2017, focused on your career development, Erin Albert. More on me over at my website, erinalbert.com. Or let's connect over at Twitter. My handle is at Erin L. Albert. Today, we are talking to an unusual type of individual for the Pharmacy Podcast. He's a tech entrepreneur. Mr. Doug Hirsch has joined us today on the Pharmacy Podcast to talk about GoodRx as co-founder of that app and web portal about drug price transparency, as well as a new initiative that GoodRx has partnered up with Express Scripts on called Inside RX. We're very excited to have Mr. Hirsch join us. He has an extensive background in technology. He was one of the early workers for Yahoo, also worked with Mark Zuckerberg over at Facebook. He's responsible for tagging, believe it or not. So the next time you tag a photo, think of Doug. Doug, thank you for joining us on the Pharmacy Podcast.
Thanks for having me.
So, Doug, you're kind of an unusual guest for us, but since I focus predominantly on career development, I'll ask you the same question that I ask everybody when we start talking. How did you get to where you are today?
You know, I've spent most of my career just following what I find fascinating and interesting. And I've really spent the majority of my career in technology. I worked at Facebook, and before that I worked at Yahoo. And in all cases, I've tried to solve some just big, messy problem that just looked too tempting to avoid. And I just wanted to kind of get into it and see what I could do. And I don't think I have to tell you that healthcare and specifically pharmacy in this country is particularly messy. And when I stumbled onto this, I couldn't resist. I wanted to see if I could try to improve the status quo.
Well, so then other than the messy component, both in tech and healthcare, can you kind of compare and contrast working within the technology sector and then transitioning over to the healthcare sector before we start talking about why you're here with us today?
Yeah, it's fascinating. I mean, technology, we move really, really fast. You know, I mean, products for me are usually 3-month experiences from conception to actually execution. You know, healthcare moves much slower for some very good reasons. I mean, people's lives are in the balance here, and big companies, and there's legislation and regulation that, makes sure that we do the right thing. But, you know, that doesn't mean there shouldn't be innovation. And so it's been really, really refreshing to spend what I think is now 10 years really trying to bring that same spirit of innovation and moving fast and consumer-focused technology innovation to healthcare to see if we can just marginally improve the experience for consumers, because even little wins can have a huge impact on the lives of millions of Americans.
Absolutely, in healthcare. And we definitely and desperately need more innovation in healthcare. So let's get to the heart of why you're here today. GoodRx. Tell our listeners about it. Tell us the kind of evolution of it and why you wanted to be a founder of it.
Sure. So as I mentioned, I had worked at Yahoo for about 10 years, and I had built a whole bunch of products really trying to help consumers and bring consumers together on the internet. Then I went to Facebook, where my co-founder and I built Facebook Photos, and we actually co-created the concept of tagging people on a photo in Facebook. So if you've ever done that, or if your kids have ever done that, that was my responsibility. Please don't hold it against me. And then after Facebook, I had started my first company that was sort of in healthcare, which was it became actually one of the web's biggest social networks around healthcare. It was a company called Daily Strength. It still exists today. And it was, for me, that was just sort of bringing the modern technology that existed to bring people together and applying it to the things that mattered to people around me, which was at that point, I just become a parent, and I was seeing my parents getting older, and I was really trying to focus on how do we bring the tools that are so prevalent in teenage and early 20-something experiences to the people that need it as they move into their 30s and midlife. And so that was sort of my first entree into healthcare. But then after that company, I eventually sold that company, and I was looking for something to do. And I went to go fill a prescription. I mean, it was as simple as that. I walked into a big chain pharmacy and presented a prescription my doctor had given me. And they wanted like $400 for this prescription. And no one had warned me. No one had given me any basis to think that this would be an expensive drug. And so because I do everything online, I took it back and I went to another chain pharmacy down the street where it was, I think, $300, which was, 25% less for the same product. I went to a third pharmacy where the very nice pharmacist, I think, quoted me $450. And then when I walked out of the store, she came out of the booth and ran all the way in the parking lot and said, well, I know I said $450, but I can do better. Let's work a deal. And for me, this just was eye-opening because I just was amazed that there was no way to compare drug prices. I had no background in pharmacy. I'm not a pharmacist. I'm just really a consumer who wanted to see if I could figure out how to take this very complicated system and make it into something that the average American can simply understand and make the right choice around.
And you founded GoodRx in
2011.
Okay. And so for someone that hasn't seen what GoodRx is, explain it to me like I'm 5.
Sure. So we started out just trying to gather prices from everywhere. And I think for your audience, they'll understand the usual and customary or the retail price. And then there's many, many ways that consumers can get less than that usual and customary price, whether that be your insurance copay, whether that be these pharmacy discounts that exist. There's manufacturer copay cards. Obviously, there's Medicare and Medicare copays. And so what we really set out to do, and we still try to do today, is to take all that information, and I mean billions of prices for the thousands of FDA-approved prescription drugs, bring them all together, and just say to you as a consumer, hey, this is what you should pay, and this is how you should buy this drug. And when we first started it, our thought process was, this will just work for the very, very small number of Americans who don't have insurance. And at the time, this was before the ACA had come into effect, we just assumed that there would be less and less Americans who didn't have insurance. And then what happened all of a sudden, which we totally didn't expect, was we became a huge resource for the underinsured. That's for the people who have insurance, but for whatever reason, whether they be deductible limitations or formularies or prior authorizations or donut holes, there's 1,000 different ways that consumers were being stuck with that huge usual and customary retail price. And so we suddenly found that about 3/4 of the people that came to GoodRx had insurance, but were still paying too much and simply couldn't afford the prescriptions. And so today, that was a long way of saying we gather prices, we show consumers how they can save, and hopefully demystify the whole process of paying for a prescription.
So tell me how patients can access it. Is it online? Is there a smartphone app, Android, iPhone?
Yes, so we have all the above. So
Okay.
you can use our desktop website, which is www.goodrx.com. We have a mobile web experience. We are the number one free medical app on the iOS and Android stores. It's pretty easy to find.
So no cost to utilizing the service.
It is 100% free to use GoodRx. We really pride ourselves on not asking for anything, for no personal information, nothing to sign up for. You just go in, type in the name of your drug, and you see what the prices are and the available discounts.
So what if you have an insurance card? How does that part work? You just keep out of that completely and it's just straight up cash pay costs, or how does that part work?
Yeah, so we would love to have insurance copays on the site. That's actually quite hard to do because the information between the pharmacy benefit manager and the consumer is effectively confidential, and we don't have access to that. We do have some guidelines, like we know that drugs are generally about a $10 copay for most consumers. We do have every Medicare Part D and Advantage copay built into GoodRx. I would dare say as good, if not better, than what you can find on Medicare.gov.
Okay.
So any consumer can go to GoodRx, can locate easily their Medicare Part D plan in their county, and then compare their Medicare copay, because it may not actually be as good a price as some of the other ways that you can purchase the drug. So you can't usually combine a GoodRx discount with your insurance, but you can compare our price to your insurance, which is remarkably lower very, very frequently. So, a $10 copay isn't so good when I can show you a drug where you can get it for $3 just by paying cash or using a discount.
So the reason we got connected today was a new initiative that GoodRx has started called Inside RX. Can you explain to our listeners what that's all about?
Sure. So GoodRx works with anybody who ultimately shares our goal of reducing the cost of prescriptions for Americans. That's all we care about. And there's a bunch of ways we found that you can do that. One is just working with pharmacies directly. Another is working with pharmacy benefit managers. That's companies like Express Scripts or Caremark or others like that. So for this particular program, we started talking to Express Scripts, who has this new subsidiary called InsideRx. And we both shared the same goal, which is we just wanted to see what we could do to bring down the cost of brand name drugs. GoodRx does a really amazing job on generic drugs. I mean, we find savings around 90% on most generics, and that's because of the market forces at work and competition. Any of the pharmacists that listen to you probably know that the actual ingredient cost of generics is usually quite low. But for brand drugs, there's one manufacturer. It's still quite expensive, and so we partnered up with Express Scripts. We partnered up also with the major pharmacies out there, as well as the drug manufacturers themselves, and said, hey, can we all get together and see if we can make a dent in the cost of brand name drugs? And I'm proud to say that we only launched this about 2 weeks ago. We have over 50 drugs now in the program with an average savings of about 35% off the list price of that drug. And, I want to be clear to consumers out there, brand name drugs are still too expensive, and we're going to do anything in our power to help. We also list other ways, patient assistance programs and copay cards and anything a consumer can use. But we're proud to say that now for someone who is a cash paying patient or someone who's underinsured, you can now take advantage of this new InsideRx discount to save 35% off the cost of your brand name drugs.
So let me play devil's advocate as a pharmacist for a minute. If you've got a patient that's taking multiple medications and they're doing their best to try to, afford them, what about drug utilization review if you've got multiple drugs for one patient at multiple pharmacies?
Sure. We've heard this question before, and it's certainly something that we hope a pharmacist is always reviewing the prescriptions that the patient takes with that patient. Our general perspective on that is that there's a ginormous amount of prescriptions that simply aren't filled by patients because they're too expensive. Prescriptions are regularly abandoned at the pharmacy just simply because patients can't afford them. And so we focus primarily on the ability for a consumer to be able to afford their prescription so they can actually take it and adhere to the regimen that the doctor gave them. That said, patients can submit their purchases to their pharmacy benefit manager for both tracking and for approval. And I also believe that there are a number of industry-wide systems that also do check for controlled substances and other things to make sure that consumers hopefully are complying. It's certainly an issue. It's something that we think about a lot, and we are happy to work with the industry on. But we've been doing this for 6 years, and we found that so far that hasn't been an issue that has been a significant one for us.
So I guess my next question is, how could our listeners leverage this service with their patients?
Sure. So, what's amazing about our product is when we started this, again, we're a bunch of tech geeks, right? We didn't really think much about necessarily how to talk to the healthcare ecosystem. I didn't actually know what an electronic medical record was when we started this company. And then what happened was doctors started coming to us and medical professionals started coming to us and saying, we're being deluged by our patients who just like what happened to me, where I handed my patient a prescription. It's not my job to know the price. And then my patient got very upset with me and didn't take the drugs I asked them to take and ended up costing my front office all sorts of time and just causing all these issues because, cost was really preventing an effective medical treatment from happening. So we've developed an amazing relationship with the medical community as a whole. We have, at last count, I want to say more than 300,000 doctors actively distribute GoodRx within their practices. We work very closely with physicians' assistants. We work closely with hospitals, with clinics. I get phone calls regularly from hospitals who have my cell phone back from the old days of GoodRx, calling and saying, hey, I have a patient who has diabetes who I'm discharging. I want to give them GoodRx information. And so we've really started to work with the entire healthcare ecosystem. Our pricing information powers Hippocrates, for example. We have very robust APIs that we work with a bunch of electronic health records and electronic medical records. And we're actually working directly with pharmacies as well, who have come to us and said, hey, I don't want people leaving my pharmacy without their prescription. I want to be able to help them. So we really work with anyone who wants to work with us. We'd love to. Our ultimate goal remains to educate patients and help them afford their prescriptions.
So what's your vision for GoodRx moving forward and for InsideRx? Do you plan on expanding? Is there other areas of healthcare that you'd like to get into?
Yeah. So it's funny, we've been asked to do this in, I want to say like over 30 countries. But we find that we have so much work to do in America. What I think the annual drug spend in this country is over $400 billion. And we've saved patients so far in our company's brief history about $3 billion. So we have a ways to go just to solve the problems that we have in this country. And regardless of what happens in politics or whatever things look like, it seems like patients are going to end up spending more for their prescriptions. And we want to be there to help. When it comes to brand name drugs, that remains a really sticky spot for patients in this country. I'm really excited about InsideRx because I feel like it's the beginning of something big. It's amazing how much enthusiasm we found from both the manufacturers, the pharmacies themselves, obviously Express Scripts and ourselves to really start doing something about this problem. And so today we have 40 to 50 drugs on our list. We have a ton of manufacturers that have been calling us. We have a ton of momentum. And so I'd like to see a situation where we have hundreds, if not thousands, of brand name drugs on our list. We're really effectively starting to bring them at cost for cash paying patients. And that we can also just create sort of think of it as a language around drug pricing in this country, because it's been only recently have people actually started to think about the fact that they can both comparison shop and understand the cost of a prescription before they're standing in the pharmacy in front of their pharmacist.
So great. Well, can you share with people how they can find you and find GoodRx?
Sure. Yeah, so GoodRx is super easy to find if you just go to www.goodrx.com or download our app from the iOS or Android stores. All of our discounts and pricing is built into all those experiences. So if you're looking for those brand name InsideRx discounts, you can just download the app and you'll see them right there, or just go to our website. We also work very closely with doctors. So any medical professionals can go to goodrx.com/doctors and they can see all the various materials and information that we share with the medical community. And then lastly, we also have another business, which is where we provide our technology to pharmacy benefit managers and other entities that are looking to provide pricing within their plans for funded plans that want to be able to help members of their plans understand their benefits better. And that's a program called GoodRx for Benefits that people can contact us and we can send them information on. Again, we're solely focused on trying to do our best to make prescriptions affordable for everybody, regardless of their situation.
Well, with that, Doug Hirsch of GoodRx, thank you for joining us on the Pharmacy Podcast. And it sounds like GoodRx is something we all need to start downloading.
Well, thank you.
All right. Are you ready for our speed round?
I will do my best.
All right. What podcasts are you listening to right now?
Well, I was inspired by Serial, so I started listening to S-Town, which I'm doing pretty well on. I like it a lot. I'm also a fan of, I love The Moth. I'm a huge Moth fan, and I'm a huge fan of the, what's the other one? Planet Money, TED Talks, and then Damn Interesting. And then the most recent one I really discovered that I love is How I Built This, which maybe that's because I'm an entrepreneur. I'm kind of excited to hear other entrepreneurs' stories.
What books are you reading right now?
I just finished Gentleman in Moscow, which was an incredible journey through, I think it was early 20th century Russia, which was fascinating. And then I've also been reading this more self-helpy book called The Untethered Soul. I'm only about a quarter of the way through, so ask me in a few weeks, I'll let you know how it is.
What's your best time management tip?
With an entrepreneur, I find focus. There's 1,000 things that can distract me. And so I'm constantly asking myself, is this a good use of my time? Should I take this phone call? Do I need to spend this much time on this issue, or can I move past it? Because there's just so many hours in the day. There's too many emergencies. And so I'm constantly just double checking myself to make sure that this is the best use of my time, and if it can wait for later. And prioritization is my biggest focus.
If you had one word that you could use to describe the U.S. healthcare system right now, what would that word be?
That is printable over the air. I would say complicated. It's been amazing. We've been doing this for 6 years, and I feel like I'm learning something new every day, just about how complex it is and how big it is. and how unique it is versus, every other person I meet from another country just cannot believe that this is how it works. I find it fascinating, but I also find it incredibly complicated.
And last but not least, what's the best career advice you ever received?
Oh, man, that's a hard one because I've had so many amazing people, especially in the technology space, who have helped me, guide me through my life. But I would say, when I was at Yahoo early on in 1996, before the company had gone public, I had an amazing manager, a woman named Ellen Siminoff, who just gave me tremendous advice on making the right choice and moving on and not looking back, and just really kind of showing me how to move quickly. And, especially when there's uncharted territory, don't doubt yourself, make a decision, be confident in it, and live by it. And I still try to do that today.
You didn't get your best career advice from Mark Zuckerberg?
Well, I did work directly with Mark, and he does give great advice. So yeah, I'll throw him in the next one.
All right, fair enough. Doug Hirsch of GoodRx, thank you for joining us on the Pharmacy Podcast.
All right, thank you so much.
We hope you enjoyed another episode of the Pharmacy Podcast Show. Be sure to subscribe to the show and send us a voice message with your ideas and comments from our contact section on the website. Did you know we develop digital health content to assist with business development and marketing efforts? Learn how we can help you drive more patients, physicians, and targeted leads to your website. Contact us today at pharmacypodcast.com.